Good morning, everyone. I am Dr. Piyush Singh, Counselor, Embassy of India, Berne. I welcome all of you to this webinar on opportunities in Indian medical technology sector today. Access to effective, safe, quality assured, and affordable medicines, vaccines, diagnostics, and devices is the key to progress towards universal health coverage and sustainable development goals, to which India is firmly committed. The Government of India has undertaken a number of reforms for further increasing the ease of doing business in India and for further integrating a self-reliant India with the world. Today's webinar will focus on both aspects of it, investment as well as trade in the Indian medical technology sector. India and Switzerland have long-standing dynamic partnership. The embassy has been running the MISSP program for further enhancing the linkages between the Indian and Swiss business ecosystems. In the last 6 months, more than 50 Swiss companies have onboarded on this program. Today, our presenter includes the knowledge partner of MISSP, T&A Consulting, the legal partner of MISSP, Rodel and Partner, and our guest speakers from the Engineering Export Promotion Council of India. With those words, now I invite the first speaker of the day, Mr. Tarun Gupta, to please make his presentation on Indian economy amidst the COVID-19 crisis. Mr. Gupta, the screen is all yours now.
Thank you. Thank you, Dr. Singh. Allow me to pull my presentation. And while I do that, I would like to thank everyone for taking time out for joining this webinar session today. And this is good afternoon or good morning to wherever people have joined in. Just bear with me. If I can pull in the presentation. Yeah, just should be there. Yeah, here we go. Okay. So, first of all, as we are living in midst of a current crisis, as one wise man said, that every crisis presents an opportunity. This current pandemic will result in new business models, new business partnerships. Can India be a preferred business partner for Switzerland? What is changing in India? What has changed? What are the opportunities, the challenges? And the idea would be to give you a very balanced view and not the Bollywood version. During this pandemic, we've had a series of webinars, presentations. What our aim, and I'm aware of death by PowerPoint, my aim would be to leave certain key messages in every slide. So let's begin. How do you define India? I would say 4 Ds are the best description to define India: democracy, demography, diversity, and disparity. Democracy, we are the largest democracy in the world. 900 million people were eligible to vote. 600 million people voted. Results were out in a couple of hours. However, the democracy can be chaotic. Decision-making can be delayed. Demography, we are the youngest country in the world. Median age of 29. We have 70% of our population in the working age group. We account for nearly 20% of the global work pool. We will have 8 to 9 million people, the population of Switzerland, entering our job market every month. However, we need to provide jobs. Diversity. India is more diverse than Northern and Southern Europe. We have 22 official languages, varied eating habits. So India is not for a new company, a one unified market. Moving on to disparity. India has the top 1% controls nearly 60% of the country's wealth. Top 10% control nearly 77% of the country's wealth. Even the economic development across the states is not uniform. There can be a difference of up to 10x between the states, which in other markets like China, Brazil is 4x. So how do we as a country plan for a more equitable development? And I would like you to draw your attention to the sectoral contribution, where India is the only country which leapfrogged from agricultural to services. I am proud of our services sector, our information technology sector, accounts for nearly 9% of our GDP, one-third of our exports, but it employs only 1% of our working population. So the message, we need to get our manufacturing right. So what's our vision? We want to be a 5 trillion economy. And what it will take an 8% real growth rate. Is it ambitious? Very ambitious. Okay, but realistic. What are we doing for it? It took us 60 years to reach our first trillion, another 7 years to reach our second trillion, and now we need to double our GDP in 5 years. And what it would require is investments, savings, and exports. And look at our investments. Over the last 70 years, we've got $600 billion of total investment. But 50% of that investment has come in the last 5 years. And 90% of that is automatic route, no government approval required. And why it is relevant? So as a foreign company, you don't necessarily need to share your intellectual property or with your trade secrets with a local partner. And why is India now the third most preferred Greenfield destination? Why? The answer is our improvement in the doing business ranking. We have improved 79 positions in the last 5 years. And today we are ranked number 63 in terms of ease of doing business. And there is a new term called MIVIT. Earlier, everybody has heard of BRICS. Now MIVIT is Malaysia, Indonesia, Vietnam, India, and Thailand. And look at our ranking there. We compare very, very favorably amongst all the MIVIT countries. But what we have different is that we have a large domestic market. So that brings me to the end of my first section of the presentation. How do you define India? 4 Ds and our vision and our ease of doing business. Second, what is the India opportunity? That can be defined in 4 alphabets: CFID, consumption, formalization, infrastructure, and digitization. Consumption. India is the world's 6th largest consumer market currently, and is expected to be the 3rd largest consumer market in about 10 years. Our whole consumer demand is expected to increase 4 times from 1.5 trillion to 6 trillion in the next 10 years. And India is the consumption-driven economy. Unlike other countries which are export-driven, 60% is domestic consumption. But one of the important points I would like you to draw your attention is to the pyramid, wherein we have about 10 million households which earn annual household income of $30,000, and another 25 million households between $15,000 to $30,000. And why these figures are relevant? Because this is about 200 million people. A lot of numbers get bandied about India's middle class. I think this 200 million is the real consuming class. And so sometimes companies have gone wrong also in overestimating the size of the market. But 200 million is a fairly substantial and fast growing segment. So consumption. Second is formalization. And what do I mean by formalization? India has 75 million enterprises, which is nearly 22 times the number of enterprises in the US, which is 8 times our size. So what is the story behind it? Out of 75 million, only 10 million had any kind of tax registration. Only 5 million have both tax and social security registration. So really you have 60 million in the informal category. If you look at the graphs, 85% of all our manufacturing firms in the organized sector are less than 50 employees. And even after 10 years, we have most of the manufacturing firms with less than 100 employees. And we've called them dwarfs for a reason, because the economic value added has been less and it has impacted productivity. So what we need is not dwarfs, but babies which grow up into adults as they move forward in the economic growth. Second reason we need formalization is to improve our tax to GDP ratio. If you look at the graph, it's about 17%, and only 5% of our population pays income taxes. And comparable figures of tax to GDP for emerging markets like China, 22%, South Africa, 27%. And finally, we need to bring about enforcement of contract, sanctity of contract. And that's why we have the bankruptcy code, where first time in India's history, we had companies moving into liquidation. Third part, I, is infrastructure. Currently, we spend about $150 billion annually, And if we have to achieve our vision of 5 trillion economy, we need to double that run rate to about $300 billion. Yes, current pandemic may put a question mark. Do we do that? But we have achieved tremendous milestones. Let me give you examples. Our highway length is about 140,000 kilometers, of which 30% has been built in the last 6 years. We plan to build another 60,000 kilometers in the next 5 years. So really, in 10 years, we would have doubled our length of national highways. Today, we are building 30 kilometers of national highway every day. Railways, a similar story. Our total track length is about 68,000 kilometers. We have electrified 30-odd thousand, and we plan to electrify the entire in the next 5 years. Solar capacity. We have increased our solar capacity in the last 10 years by 1,000 times. So infrastructure, and 70% of all the infrastructure spent is coming from the government, public. So hence we need to improve the tax to GDP ratio. And finally, the fourth part of our India opportunity is digitization. You look at the pyramid, it's a unique model wherein we have 1 billion people with their biometrics. So what this shows is that India stack, which is based on presenceless, paperless, cashless. We are aiming for a holy trinity called JAM, where we have 1 billion people on mobile, 1 billion people on our biometrics, and 1 billion bank accounts. We have opened 380 million new bank accounts. And why it is relevant is that we have moved a lot of public benefits transfer online. Today, over the last 6 years, we have transferred $100 billion of benefits and reduced the corruption and leakages in the system. And today, our online payments, the retail transactions have crossed 1 billion transactions in a month. And compared to 70 years, we have only 50 million credit card holders. And why we've been able to do that is because of our use of mobile internet. We have 600 million people accessing the internet over mobile, and the use of data has increased by 44 times. So we talked about opportunity. How are we doing? If there's an opportunity, what about the tax rates? India has made a dramatic downward revision on its tax rates. Today, our tax rates have close to about 25%. And we've also, for new manufacturing, we've got it to 17%. Our tax authorities were known for their litigation, but now we have signed 300 advanced pricing agreements. So really, we want to offer predictability. We have also made changes in our indirect tax. We have now one unified country where we have our GST. Of course, it's work in progress, but it has improved our logistics efficiency, our transit time, and also our whole warehouse efficiency. We are now looking at 10 times bigger warehouses, cutting down on the lorry transfer from Delhi to Mumbai by 20 to 30%. So this brings me to the end of my second section of the presentation, where we spoke about India opportunity, consumption, formalization, and infrastructure and digitization, plus a rationalization of tax rates. And finally, I move to the last part, which is reforms. And it can be put in 4 letters. Laws first, and then we talk liquidity, labor, and land. We have repealed 1,000 laws in the last few years. We have launched online portal so that everything is transparent. And you look at the cost of compliance for import documentary credit, how it has gone down. So we are making changes to reduce the compliance burden. Liquidity, that's been a challenge. Our new stimulus package is not throwing money, but making sure we are able to provide collateral-free loans of $40 billion. We've reduced our bank lending rate. And finally, to 2 big reforms, labor and land. All states are becoming more competitive to reduce the labor compliance burden. At a central level, we are codifying 44 central laws into 4 broad law codes. And finally, we are making land reforms. Land is an expensive proposition in India and cumbersome. We are taking it online. We are making sure you can buy land directly from the farmers. So all these processes, in fact, what we have is 44 industrial clusters where 2 million square meters of warehousing industrial space is available for possession in the next 8 to 10 weeks. So with that, I end my presentation by showing how foreign companies from across the globe, across sectors, have a presence in India. And we love to see more Swiss flags here. And with that, it brings me to the end of my presentation. I'm happy to take any questions at the end. Thank you.
Thank you, Mr. Gupta, for condensing your comprehensive presentation into 11 minutes. So now I move on to the next presenter, who is Mr. Ashwin Merchant from TNA Consulting, and he'll be making a presentation on overview and opportunities in the Indian medical technology sector. Mr. Merchant.
Somehow my cam is not coming on, but I hope you can hear me. Okay, great.
Yeah, we can hear you.
So
That's fine.
let me start my presentation with a very small story. On the 1st of March 2020, exactly 2 days before the WHO spoke of global shortage of personal protective equipment, PPE, India had zero manufacturing capacity for PPE coveralls suitable for COVID-19. Thanks to imports in January 2020, we had a stock of 275,000 PPE kits when the pandemic hit the country. However, 78 days later, on 18th of May 2020 to be precise, India was manufacturing nearly 450,000 PPE kits every single day, and today nearly 500,000. This was just to get your attention. Now I'll have to speak very fast as I have only 11 minutes left. Let's talk about the medical devices industry. The Indian medical devices industry accounts for about 2% of the whole global industry, which stands at around US dollars 250 billion. This industry is growing at 15% year on year over the past few years, which is more than the double of the global rate of 4 to 6%. It contributes approximately 4 to 5% of the total Indian healthcare industry. Many estimates on the internet say that the Indian medical devices market will grow to a 50 billion industry by 2025. But this figure is a bit controversial. When you think that it took us a few years to reach 10 billion, and then to think that every year you're going to add 10 billion for the next 5 years, it's not happening. However, there is no denying that the market is dominated by imported products, which account for nearly 80% of the total sales. And before I move to the next slide, remember, 100% FDI is allowed in this sector under the automatic route. Segments. India figures not only among the fourth largest medtech market in Asia, but also among the top 20 markets in the world. And talking about imports, let's have a segmental look. 50% of consumables and implants, such as stents, syringes, and needles, are imported. 66% of diagnostics imaging, such as ECG, MRI equipment, X-ray machines, CT scanners, is imported. 75% of patient aids and others, such as hearing aids, pacemakers, artificial joints, are imported. And finally, 80% of instruments and appliances, such as ophthalmic instruments, dental products, endoscopy, dialysis apparatus, are imported. Now, when we look at these figures, let me mention here at the very beginning that around 40 to 50% in the consumables and instrument appliances is the share of multinational firms, as also 80 to 90% in all the other subsegments. In fact, nearly all the top 40 global medical device companies have a presence in the country today. But most of the production base is outside India. They just simply import the products for the Indian market. In fact, only 3% of the manufacturing sector generates sales between $20 million to $100 million, and 2% above the $100 million, mostly multinationals and a very few number of large domestic players. So what are the growth drivers? Here, let me start with a very discomforting fact. When we talk of medtech, keep in mind, India houses 18% of the world's population, but it also houses 20% of the disease burden. According to a Lancet research paper, India has one of the highest incidences of diabetes, cardiovascular diseases, COPD, and asthma. Though aging population is mentioned here, I'll slightly contradict my colleague Tarun when I say that for the medical device industry, India is at 1.3 billion market. Everyone needs healthcare from prenatal health to death. Another trend out here is the increasing disposable income and the health-conscious lifestyle, especially among the millennials, which is contributing now more towards preventive healthcare than curative. The government of India has also taken the medical devices sector as a very serious industry and calls it the sunrise industry. Right now, as we speak, the Make in India initiative has projects worth about $257 million open for investment in the states of Sikkim, Kerala, Telangana, and Maharashtra. And lastly, before I go to the next slide, medical tourism is a major factor. In 2015, India ranked the third most population destination in the world, with a market worth of about $3 billion. And nearly 234,000 medical visas were issued. By 2017, the number of visas doubled to 495,000. Let's look at the manufacturing sector. You see, these are clusters which already exist today. In India, there are about between 750 to 800 medical device manufacturers, for which domestic players account for 65% with a turnover of just under $2 million each. Domestic manufacturing is actually limited to the lower end of the technology value chain, mostly driven by consumables and implants. But in addition to these clusters existing, the government has set up a scheme for medical device parks under the Department of Pharmaceuticals, by way of which $3 million or 70% of the project cost, whichever is lower, will be provided as financial assistance. Within this scheme, the government has already given the go-ahead for 4 such parks in Andhra Pradesh, Telangana, Kerala, and Tamil Nadu. And before I move to the next slide, keep in mind that multinationals like Philips and GE are using these clusters not just for manufacturing, but also for the global R&D centers and for reverse engineering. How is the environment changing? Here I will just dwell on 2 parts. First is the duties. So far, India had the scheme of inverted duties. This refers to when the taxation of inputs is at higher rates than the finished products. And this in turn led that they promoted imports rather than domestic production. A lot of Indian manufacturers actually imported Chinese products, relabeled them as Indian medical devices and re-exported them. So this is going to change very soon. And the second strong point message from here is the quality. For the first time, we have an indigenously developed quality assurance systems, the ICMED, stands for Indian Certification of Medical Devices. It has 2 options, ICMED 9000 for low-risk medical devices and ICMED 13485 for medium and high-risk devices. And both of these are synchronized with Western quality standards. Opportunities, well, there are a lot of opportunities listed out here. I'll not read through them. Of course, you can download the presentation at the end, so you have the list. But here, just the key takeaway message is that not many people realize that the Indian medical device manufacturers are also open to the idea of import and distribution. This supplements a portfolio of products. For the foreign firm, it gives them a ready and access to the existing network of these Indian manufacturers. So keep that in mind when you look at the opportunities. I would like to speak about 2 niche sectors of the medtech sector. The first one is the diagnostic market. This sector is dominated by unorganized players, but they generate about 65% of the total revenue. When you look at the industry breakup, standalone centers account for nearly 47%, diagnostic chains 37%, and hospitals only 16%. The sector consists of 3 critical components: clinical, retail, and logistics. Here, point-of-care diagnostics is gaining very much popularity because the government aims to make healthcare available to the rural population, and which has led increasingly to adoption of the hub and spoke model. Opportunities in the diagnostic sector are point-of-care testing such as glucose meters, imaging machines, MRI and CT scanners, in vitro reagents, of which nearly 77% are imported, and of course the cold storage vehicles as part of the hub and spoke logistics model. The second sector I would like to speak about is the dental market. The importance of the dental market is evident from the fact that 3 marquee Swiss companies are already present out here in the Indian market, like Straumann, Ivoclar, Vivadent, and Geislich. They have a major presence in India. The Indian population of 1.3 billion has the access only to 300,000 dentists, which includes 50,000 specialists. India has more than 5,000 dental laboratories and 300 dental institutes. But the dental sector is also highly fragmented. On the other hand, it presents an investment opportunity to foreign firms. There is a high import dependency, just like the medtech sector, for dental equipment and products. And before I move on, let me mention dental tourism. It is expected to grow at about 30% per annum, with the majority of the visitors coming from China, the UK, Australia, and Kenya. Disruptive technologies, that's the term of the hour. A 2017 PwC report, Global Digital IQ Survey, rated artificial intelligence and Internet of Things as the most disruptive technologies. In fact, a new term has been coined, IOMT, or the Internet of Medical Technology. On my side, I would call it the Uberization of the healthcare industry. Here, India has a strength because of its inherent strength in the IT industry, and as Tarun mentioned, ease of and cheap access to the internet. Before I move to the next slide, I'll just like to mention the example of telemedicine in India. It began in 2001 with a pilot project by the Indian Space Research Organization, or ISRO, which linked Chennai's Apollo Hospital with the Apollo Rural Hospital in a remote village in Andhra Pradesh. Today, ISRO's network spans 45 remote and rural hospitals and 15 super specialty hospitals, and actually reaches the islands of Andaman and Nicobar and the Laccadives, as also the Himalayan regions of Jammu and Kashmir. So how has this worked in India? The government is using the IOMT in its, these are various programs which you see with the government has initiated. I'll just mention three of them. The intensified mission Indradhanush. This program is basically to achieve universal immunization coverage for under 2 children and new mothers. The e-hospital set up by the National Informatics Center in 2017 integrates digital information to improve healthcare processes and accessibility. For example, patients can register with the e-hospital to remotely access the electronic health records, or EHRs, while doctors on the other side can utilize the clinical decision support system to obtain advice on decision making at the point of care. And the third project I would like to mention is the Anmol, Auxiliary Nurse Midwives Online, started by the Government of India with support from the UNICEF. It's an Android-based application and helps nurses and midwives to make their work paperless, allowing them to enter and update service records in real time and ensuring prompt entry and updating of data, including readily available information about newborns, pregnant women, and mothers in the locality. And the private sector, let me first of all mention that this is dominated by startups. In the medtech sector, as of 2018, there were 4,900 startups in the Indian health tech space. Overall, these health tech startups raised about 504 million between 2014 and 2018. And this is not only the startups, but even multinationals such as Philips and GE. They are making use of this disruptive technology for tele-ICU, where they're enabling physicians in urban Indian hospitals to remotely monitor and manage the patients in remote areas. I think with this, I've managed to keep my time limit, Dr. Singh. I just want to end with a thank you and say that download of this presentation is available on the MISSP website, and I'll be happy to take question and answers at the end. Thank you.
Thank you, Mr. Merchant, for your brief presentation. Let me now move on to the legal and tax side of the medical technology industry. And we have our legal and tax partner making this presentation. The presentation on legal side is being made by Ms. Apurva Singh, consultant, Rotterdam partner. Ms. Apurva.
Thank you, Mr. Singh. Can we move to the legal update slide? Yeah. Today, the healthcare industry in India is growing at a rapid pace, and medical technology has been recognized as a sunrise sector by the government. Considering the 100% foreign direct investment has been allowed in sector through this automatic route, it has attracted lucrative investment opportunities, creating growing interest among foreign players to enter India's healthcare sector through capital investment, technology tie-ups, and through collaborations in healthcare and medical tourism. Further, Make in India initiative by the government has led towards making India as the global hub towards boosting the production in medical devices of international standards and reducing reliance on import, all set towards making Indian health sector as one of the fastest growing sector. The government of India's focus to improve the healthcare sector is evident when it announced an allocation of around $9.76 billion for the healthcare sector during the Union Budget of 2021. The medical device sector of India in particular adds a sizable contribution to the Indian health industry and is expected to show a surge by crossing $11 billion by 2022. Despite all of these efforts, certain challenges which were seen recently, until recently, for instance, absence of specific regulation for this specific industry, little bit ambiguity could be seen, and coverage under the Drugs and Cosmetics Act has resulted in a lack of clarity and transparency about the regulations. Also, barring the limited number of medical devices, there was no mandatory requirement of adhering to the certain quality standards and obtaining prior approval from the government authority, which to certain extent caused resistance amongst the foreign players to fully tap the potential Indian market for the equipment industry. In order to address these challenges, certain amendments were introduced recently under the Drugs and Cosmetics Act and the Medical Device Rules 2017, which particularly deals with the regulatory framework of the medical devices. With effect from 1st April 2020, all medical equipment and devices used on humans and animals will be regulated as drugs under Section 3(4)(d) of the Drugs and Cosmetics Act. If you see, prior to this amendment, only 37 categories of medical devices had been regulated so far when it comes to import, manufacture, distribution, or sale of medical devices. Now, with a view to ensure and to address those challenges which I mentioned above, all medical devices to meet certain standards of quality and efficacy, the Indian government has given a wider connotation to cover more number of medical devices under the regulatory framework. Under the revised definition of medical device is now likely to bring medical equipments including but not limited to implantable medical devices like knee implants, CT scan, MRI equipment, which earlier remained outside the purview of the Drugs Act and the medical device rules. Moving on, also the Government of India, for these newly defined medical definition of medical devices on 11 February 2020, through another Gazette notification, released the medical device amendment rules, which require registration of these medical devices and equipment with the Central Drug Standard Control Organization, and this becomes enforceable with effect from 1st April 2020. The registration shall be on a voluntary basis for a period of 18 months from the commencement date, and thereafter the registration will be mandatory. So at the time of registration, the manufacturer and importer of these medical devices will have to upload certain information, including name and address of the company, details of the medical devices like generic name, model, number, intended use, shelf life, etc. Then there is also a requirement to upload the certificate of compliance with respect to ISO 13485 standard accredited by the National Accreditation Board of Certification Bodies or the International Accreditation Forum. The importers are also required to upload a free sale of certificate from the country of origin. With the view to ensure the implementation of regulatory provision of the medical devices rules to these newly notified medical devices in an effective manner, and also for ensuring the ease of compliances for the business, one of the important feature of these new rules is that they have prescribed a fixed timeline during which these newly notified medical devices will be exempted from all other provisions of the medical device rules except the mandatory registration requirement which has been introduced under the new rules. To conclude, the healthcare market in India yet remains to have untapped potential and can be strengthened more with the help of market player. The Government of India has relentlessly making efforts towards regulation of manufacture, import, sale and distribution of medical devices covered under the Drugs Act and the Medical Device Rules in order to ensure the quality and to bring it at par with the international standards. The recent notified definition of medical devices widely applies to all sorts of medical devices and aims to ensure that all such devices have to meet certain regulatory standards of quality and also imposes the accountability on companies who are in the business of manufacturing or importing these medical devices from the quality and the safety perspective. This naturally calls for companies in medical industry to assess with due care to determine the applicability of these recent notified definitions to their products under the regulatory framework. With this, I would like to conclude my presentation and my colleague Anand will take over.
Thanks, Apurva. Now let me invite Anand for making a presentation from the tax perspective. Thank you.
Good morning, everyone. Good afternoon, wherever you are. Let me quickly take you through the tax-related updates. Briefly, the tax framework in India, how does it look like? The direct taxes have domestic income tax laws, double tax avoidance agreements, transfer pricing regulations, country by country reporting requirements, and the newly introduced equalization levy, India's digital tax. Indirect tax covers customs regulations, foreign trade policy, goods and service tax, which is generally known as value-added tax across the globe. So this is what the general framework of the tax laws here in India is. The recent updates, which are general updates from tax perspective, last September, that is September 2019, Indian government announced a significant reduction in corporate tax rates for existing corporates from 30% to 22%, and even more reduction for the newly established manufacturing companies exclusively into manufacturing activities. Post 1st October 2019, the tax rate has been significantly reduced to 15%, with surcharge and education cess. It effectively makes it to about 17%. That's a significant rate cut considering the pre-existing corporate tax rates which were prevalent in India for a long period of time. Recently, in the Union Budget of 2020, the dividend distribution tax has been abolished, and the tax on dividend has been shifted back in the hands of the recipient shareholder. This is a big relief for the non-resident shareholders, for the foreign companies who invest in India, because earlier the dividend distribution used to get taxed at an effective rate of 20%, which can be now brought down to effectively 10%, depending on the rate of dividend tax given in the respective tax treaties. Another update is that India's digital tax, which is equalization levy. The scope has been widened significantly from 1st April 2020 to include all kinds of transaction of sale of goods or services by non-resident taxpayers or foreign companies, to include online sale of services, online sale of goods, facilitation of online transaction, etc. The scope has been widened quite significantly here. Then, for foreign investors who put in the investments through debt instruments like external commercial borrowing, etc., the withholding tax rate is reduced since a long time to 5%, which is a significantly lower rate of tax. Then we have general anti-avoidance rules, which came in effect from 1st April 2017, and other important updates like place of effective management, multilateral instrument. These are all the updates in the international tax arena. Now, moving to some specific tax benefits which medical technology sector can avail. There is a weighted deduction available under the Indian domestic tax law for in-house research and development done by the manufacturers under section 135(2)(ab), which allows 150% of the tax deduction of the underlying expenditure made on research and development activities, including the capital expenditure. And now this weighted deduction is available up to 31st March 2021, which is going to be reduced to 100% of the expenditure, which will ultimately benefit only in respect of the capital expenditure, because revenue expenditure is anyways tax deductible at 100% any which ways. The new employment generation that any manufacturer or any employer does 30% of the emoluments paid to the newly added employees is available as an additional deduction over and above the 100% which is of the emolument, which is even otherwise allowable as a tax deduction. There are certain conditions, obviously, which are attached to it. Lastly, GST and customs. There are a lot of benefits, export-related benefits like duty drawback, merchandise exports from India scheme, MEIS, export promotion capital goods scheme, and so on, and input tax refund of the input tax credit. That's all from my side from tax perspective. Thank you very much.
Thank you, Anand, for that brief, crisp, and quite useful presentation. Let me now move on to the next section of this webinar, where we invite a guest speaker representing the industry. So today we have the chairman of the Engineering Export Promotion Council of India, Mr. Ravi Sehgal, who has joined us to give us a perspective from the supply ecosystem side of the Indian medical technology sector. May I please invite Mr. Ravi Sehgal to come on screen and make his presentation.
Yeah, good morning to you and good afternoon to the rest of us. Thank you, Dr. Singh, for having given us this opportunity to be at this webinar. I represent Engineering Export Promotion Council, India's one of the largest councils which deals in engineering goods and exports of the engineering goods. We have 13,000 members spread all over India, and we ourselves have offices spread all over. And we account for almost 25% of the exports of merchandise goods from India. In 2019, it was roughly $81 billion. And this year, because of the various factors, we were down to about 76.2 billion. But we are optimistic that we'll be back to normal very soon. And 2021 March, because our accounting is April to March, we will see almost back to the $80 billion levels. Having said this, the subject today, the Indian medical technology sector, is of course one of the most prime sectors in India itself. Medical technologies are by far amongst the most advanced sector at par with defense and aerospace and precision engineering. And with the increasing integration with the information and communication technologies, semiconductor and artificial intelligence, we just heard about the IoT. It's among the leading innovative sectors in engineering manufacturing. Just to let you know that we have 800 manufacturers registered as members of our EPC India. And India today exports medical devices to more than 150 countries. We do about $1.5 billion worth of exports, but we have almost $5.2 billion of imports. And if you've heard our Honorable Prime Minister, he wants to strengthen the manufacturing base in India and then to reach out to the world, and is inviting all the possible manufacturers to come and set base. And India has its definite advantages because the wide local, domestic sector itself, besides the raw material, the trained and skilled people, from the labor to the supervisor to the engineers. So you get all of them ready. And of course, pharma machines being, manufactured in India are considered to be one of the cheapest in terms of the cost. And hence, it is a very strong point for India to have a stronger manufacturing base. Medical instruments is the top segment, followed by the orthopedic implants. Of course, the whole industry is in a phase of growth and transition. Since recently, India has also gained expertise in complex implantable devices, which are made of titanium alloys, and for diverse applications, including osteointegration, for integrating with surrounding tissues with implanted devices. Besides, it has been supplying high-precision components, sub-assemblies, printed circuit boards, assembling implantable grade materials and sterile packaging, biodegradable implantable materials, noble metals, and biomaterials like various types, nitinol, polymers, silicones, epoxy, microelectronics, polymers, laser welding, hermetic sealing. These technologies are extensively used in the private sector. Being one of the fastest growing healthcare market, India is home to many of the top 10 medical technology companies in India, such as Medtronic, Abbott, GE Healthcare. These are among many, those who have set their major R&D centers in India, Stryker, GE Healthcare, etc. There are also several domestic players who have global presence in supply of high-end medical technology products, such as Privitron Diagnostics, Forus Health, Nidhi Meditech Systems, Hindustan Syringes and Medical Devices, Opto Circuits, etc. And mind you, with the focus of the government, now in Andhra, we'll have special areas. We had in Himachal Pradesh, up in the north in Baddi, a strong base. And this is the focus sector. In fact, yesterday I was with in a video conference with the Commerce and Industry Minister, Mr. Piyush Goyal. And the focus today is to try to increase our reach to the globe and to increase our base of manufacturing here. So whereas we are also open to the idea of imports coming in and technologies coming in, the advantage with EPC India is we have set up a tech cell. The technology cell of our EPC looks into development and making matches, in the sense that if we find international technologies available, there are automations available or processes available, we disseminate the information to the members and in fact try to align and bring them together so that not only the technology is upgraded, but the advantage is both to the persons bringing the technology or the equipment or instrument into India and taking back and selling either on a buyback basis or to the world. Recently, the government of India has actively encouraged technology upgradation at various levels in medical technology sector. The medtech sector assumes priority with India's highest office of scientific advisory to the government, that is Office of the Principal Scientific Advisor. The Ministry of Health has accorded healthcare as a sunrise sector. The Department for Promotion of Industry and Internal Trade has identified it amongst the top 25 sectors in Make in India. Likewise, the Ministry of Commerce and Industry through EPC India has been promoting medical devices as one of the brand India engineering sectors to highlight quality exports from India. We had launched the e-catalog, and we are very thankful to the Embassy of India in Berne for promoting this and putting this on their website. And this is what the government of India is pursuing and also assisting in setting up high-tech medical devices manufacturing parks, as we just heard. And it has also set up the largest integrated 3D printing facility. We at EPC also promote this 3D technology to our own members, and we look forward to interacting with further more inputs from overseas. Indian government is also rationalizing quality accreditation and standards ecosystems to encourage more and more private players, even those in small scale sector, to adopt voluntary standards which are accredited with leading products and system standards of EU, European Union, US, and Japan. And the beauty is most of our members, over 60%, are belonging to the micro, small, and medium scale sector. And we look forward to developing technologies with them. The Indian government has also taken several measures which have benefited and strengthened the Indian medical technology sector in a major way. Amongst the few measures which is helping medical technology sector currently are, one is the opening up of private labs for medical testing, which has increased the testing capacity in India, and this is helping us during these COVID times. The second is empanelment of private healthcare facilities to add more capacities to deal with the increasing number of patients. Number three, encouraging private players to manufacture essential medical products such as ventilators, masks, face shields, clinical gloves, hand sanitizers, sterilization equipment, and these are the things which are in big demand today. Streamlining the support ecosystem that would ensure smooth transport and logistics to supply such essential items to different regions of India, deploying the air services and railways. So friends, basically, the idea is to let you know that India has become very proactive in terms of the medical and health industry. And the above measures have also strengthened the research and development, the academia, the industry collaboration in the ecosystems in the country. And a lot of MSMEs and entrepreneurs have come up. In fact, the PPE kit, which we were importing 100%, now we have started, we are in a position to sell it to the world. And India has no doubt a lot to learn from the Swiss medical technology ecosystem, a country of 8.5 million, but boasts of world's leading medical technology suppliers, numbering as double of that in India, with around 1,400 companies and predominantly MSME. So India, and I'm sure the Swiss companies, can match very well in their thought process, in their development process, and the future of growth of medical equipments in India. EPC India would be pleased to facilitate any technology collaboration among Swiss and the Indian companies. India is rightly positioned to partner Swiss in providing the required destination for sourcing quality products. It also offers promising partnerships for high quality investments for growing Indian healthcare market segments. I'm thankful for having been given this opportunity to be speaking to this wonderful audience. And I'd like to thank Dr. Singh for having given us an opportunity. India shall work with you, sir, and with any company in Swiss company that would like to collaborate with India. With these words, I thank you once again. Thank you.
Thank you, Mr. Sehgal. Thank you for participating in this webinar and for giving such a broad and comprehensive overview of the Indian medical and health industry. Thank you. I shall move on to the Q&A session of this webinar, and I'll ask the questions in the order of the presenters in which they appeared. So I have a few very interesting questions before me. The first question I'll pose to is Mr. Tarun Gupta. The question relates to the Ayushman Bharat scheme, and it asks that has it led to an increase in medical equipment manufacturing in India? Can you please come on screen, Mr. Gupta?
Just for the benefit of the wider audience, Ayushman Bharat is one of the biggest, if not the biggest, health insurance scheme in the world, which is plans to cover about 100 million families, and about treatment of about 7,000 Swiss franc annually. So what it has done is, over the last 3 years since it was announced, we already have over 125 million insurance cards issued, over 20,000 hospitals empaneled. It covers about 1,400 different types of treatments across 24 specialties, and more interestingly, 5 million treatments, surgeries have already been covered, and over £1 billion Swiss franc already reimbursed. So this gives you an idea how Ayushman Bharat is driving our improvement in healthcare, which enables hospitals to buy those equipments which are covered under the scheme, and also it gives them reimbursements, and all these surgeries are at a set price. But here I must add, the price sensitivity is extremely critical of the equipment which is being purchased by the hospitals.
There's one more question again posed to you, Mr. Gupta, which is how has the increase in ease of doing business impacted the medical technology industry in India?
I think, as Mr. Sehgal mentioned, medical technology is one of the focus sectors of the government, and rightly so. So what we've seen is we are also seeing a cluster approach, wherein we have specific medical devices, medical technology clusters being set up, right? And we are also seeing more improvement in terms of any regulatory approval process and all that. So we have some of the larger names globally who have set up production in India. But now what we are seeing a trend among some of the younger companies also, younger technology-led companies from overseas, to look at partnering with India.
Okay, thank you, Mr. Gupta. The next question is for Mr. Merchant, and it refers to your mentioning about the medtech startup ecosystem in India, and it asks whether there is a collaboration.
Thank you for this question, Dr. Singh.
Taking place between the
I hope you can hear me. I'm
Swiss
sorry, I'm not on camera. Okay. Well, actually, it's a very interesting question because there's a very strong connect between startups in India and Switzerland. It is facilitated by an organization called SwissNex, which is housed within the Consulate General of Switzerland in Bangalore. And they work with industry, they work with academia, they work with startups, and basically they bring all stakeholders together. Starting from 2016 and 2017, they have been bringing health tech startups from Switzerland to India for the medical exhibition. In fact, last year they also had a digital health conclave held in Bangalore, where they brought in innovators from the digital technology, startups, researchers and academicians from the University of Basel, University of Zurich. They had industry experts, as well as they joined with industry experts from India. And what they were focusing on was more of blockchain, value-based healthcare, intelligent DX, clinical trials, AI for antimicrobial resistance, research collaboration. They have been very active going on from there, and they're strongly supported by an organization called the Swiss Business Hub India, which is the Swiss government's official trade and investment promotion body based within the embassy and in Delhi and the consulate in Bombay. So these two organizations work together in bringing startups, and medical technology is only one sector. They also work in fintech, blockchain. But yes, there is a very strong connect.
Yeah, thank you. Thank you. Let me also add to that answer that this the overarching framework under which the startup connection ecosystem bridging works is the India and Switzerland Science and Technology Agreement, under which there is a joint committee on science and technology, and which basically every year there's a program in which there's a SwissNex India, and then there's an organization falling under the Department of Science and Technology of India. They bring together entrepreneurs and startups from both sides, and then they visit India. I mean, the Indian startups visit Switzerland, and then there's a bidding process, and then eventually the best startups do get funding too. So it's the overall India Switzerland science and technology framework under which the startup ecosystem of India and Switzerland are integrating. Thank you, Mr. Merchant. Now let me move on to my next question, which is posed to Anand, which says that we have heard about tax holidays by state governments in India. So if you could tell us a bit about them, and is there some state which should be preferred in terms of taxation? Interesting question, please.
Certainly, Mr. Singh. So if you look at the overall taxation system which has evolved through the years, in India, now there are very less number of taxes which come under the purview of state governments after the introduction of GST. Customs is central, income tax is central, GST is central. The only taxes and duties which are under the purview of state governments are stamp duties, electricity related some duties and taxes, etc. So therefore, in the previous era, there used to be huge tax holidays from VAT perspective from state governments, which was a state subject. But now post GST introduction, there are very less number of tax holidays which come under the state governments. Tamil Nadu offers some exemptions and incentives in stamp duty. There are some other states which offer similar type of tax holidays only with respect to limited to stamp duties and electricity related some reliefs. But post GST, there are no major tax holidays which come under the purview of state governments.
Thank you, Anand. Next question is for Apurva. What are the various modes for establishing legal presence in India, and which mode should be preferred for a company making its first foray into India? That's a question which we get asked regularly. So, but be brief because we're already short of time. Yeah.
Yeah. So to sum up, basically, it depends on what exactly the business model would be. So there are 4 ways of having your presence in India, like through branch office, project office, private limited company, and through your limited liability partnership firms. But generally, the preferred option, because of the flexibility involved when it comes to private limited company, this is the preferred option which is chosen by most of the investors. License office, project office have face some kind of they have certain kind of restrictions and have their own set of challenges. However, we do have a detailed article on our website, and you will be free to look at it. And if case of any detailed questions, we would be happy to help you also regarding it.
Thank you, Apurva. If Mr. Sehgal is there, there is one question that I can pose to him. Mr. Sehgal, are you here with us? Hello, Mr. Sehgal.
Yeah, I am.
Okay, Mr. Sehgal, there is a question which goes on to inquire about the innovation and R&D in the Indian medtech sector, and also about IPR protection status in India. That comes very regularly in terms of
absolutely, yeah. So of course there is a lot that the government is doing in promoting. In fact, there are incentives to do all kinds of R&D work, and especially if it is for import substitution for India, the government is promoting that. The Ministry of Commerce will take that up as a case-to-case basis. There is no such outright plan. They say you bring a project with the kind of potential and the whether it is an import substitution or it's additional exports which would be generated out of that. And regarding the IPRL, the intellectual property rights, yes, India is moving on to the international level and scale of protecting the rights. There are some hiccups there, but let me tell you, it's much better stage than what it was 5 years back. And there are a lot of lawyers and legal help that are available. If there's any particular case or any protection that is required, and that inquiry is sent to us, we will study in details and send it to you.
Thank you, Mr. Sehgal. I think with that we have come to the closer of the session, and I would just say that all the presentations that were made today would be available on the MISSP website. We'll also be turning this webinar into a podcast, and we'll be releasing it. I hope that we have been able to reiterate the idea that there are tremendous possibilities and complementarities between the Indian and Swiss business ecosystem, particularly in the medical technology sector. We'll be very happy to have further feedback from our participants and any sort of assistance which is required in terms of building contacts with the Engineering Export Promotion Council or other agencies in India. With those words, thank you so much for joining us. We look forward to also having a number of the companies who joined us today join the MISSP program of Embassy of India, Berne. Thank you. Have a good day.